Hi, I'm Dr. Robert Emmons, head of the Blood Cancer, Transplant, and Cellular Therapy Division here at U of L Health. I found my way into medicine by way of engineering, actually. I was a double E, and I started doing robotics at the University of Pittsburgh. Found I was more interested in doing what the physicians were doing than what the engineers were doing. And from that, started doing research into first the electrical fields in the human brain, and then eventually genetics when I was in medical school. Gene therapy took me on to my residency at the University of Michigan, and then to the NIH, where I participated in some of the early gene therapy trials, and now here. Full circle in my career at U of L, using gene therapy to alter T cells to correct and hopefully cure cancer. We see patients with all forms of blood cancer. That include lymphomas, leukemias, and various myelomas and plasma cell disorders. There's other rarer diseases like aplastic anemia and so on that we see as well. And we do full range therapy for these patients, including all of the current therapies, various clinical trials that we have open here, and any kind of stem cell or bone marrow transplant that may need to be applied to the patient's disease. We are also fortunate in that we have on site a GMP facility that can manufacture new therapies called CAR T cells. These gene-modified T cells can directly attack and destroy various types of blood cancer to go a step further than we can with current drugs and transplant therapies. My philosophy is certainly to always listen to the patient, to respect their wishes, to be sure that they understand every aspect of their care and are part of the process of choosing where they want to go. Blood cancer therapy is often very high-risk therapy, and blood cancers are often very difficult to treat. And so it's very important to respect the patient's wishes, make sure they understand what's going on, and that their family and caregivers understand as well. We as a team here at the U of L have a very much team approach to patient care, in that our physicians and nurse practitioners, social workers, other allied personnel that are with patients and help them through every stage of their disease, including the holistic side, the nutrition side, the other sides, the things that are often difficult to discuss in a single sit-down session. Lots of new therapies coming down the pike very quickly, but I've certainly been around long enough to know that not every new therapy really pans out for a real advance. And that's often very difficult for patients to appreciate, coming to all this new and being scared and having lots of things to consider. So one of the key aspects I think that I bring as a physician is the experience to step back and give people that perspective that they need to make the right choice for often difficult, fraught decisions. Playing guitar, exercise, having time with my son and family, and he's a handful and a lot of fun to be with, so we do a lot of sports and outdoor activities together, so that is a full range right there of activities.